Congratulations, you've made it to Makari Wellness's mobility and stability page. We have a basic Tier 1 introduction, which is the core curriculum for everybody who comes into our office, and we want you to share this with everybody out there. So these videos are lined up from top to bottom, left to right, just like you would read a book. If you happen to be using a smaller device to view these videos, like a cell phone or something, they're generally going to be lined up top to bottom in the order you do them. So progression should be limited. If you feel a lot of pain, don't do them. That's why you're in our office getting treated to get out of pain. But when you can, we want you to start with the mobility. You have to be able to move before you can train proper movement. So we have a foam roller routine here, and then we're going to do some wobble exercises to hydrate the disc. That's our basic mobility, and then you have a beginning of stability. So you're going to have basic activation where we activate the muscles of the hips, and then you're going to go into a rolling over pattern, baby rolls. You're then going to have an alternating quadruped pattern, which we call crawling, and then there's a split kneeling stance with a high-low chop lift, and from there there's a Tier 2, which is standing patterns. But you'll notice that we had a poll video at the very beginning, which was just to make people mindful of their posture, if they have a straight spine or not. And you'll find a lot of people actually have curves and they're struggling to get their body in a column fashion. And off of that video there's a little piece of standing on one leg in balance. Well, that also is in the standing progression, which we generally tailor to each patient once they get there. It's not necessary for everyone, but it is necessary for certain people doing certain daily functions and a lot of our athletes. So we look at those individuals on a one-on-one basis, and then we give them their corrections on what they need, because it can be so variable. But every one of you, if you walk, learn to walk by doing this series of movements without rubber bands, but we're going to use rubber bands here. Because you were a baby and you came out and you laid on the floor and you learned to roll over, then you learned to crawl, then you learned to kneel, and then you learned to stand. So if you have a difficulty doing any of those, you stop at the one you're difficult with. You do these every day. They're pretty quick once you're familiar with them. And generally in about 2 weeks, your neuro programming has changed and caught up with you. And once you would give yourself about a 70%, you can then add the next exercise. You're still going to cycle through in the correct order, doing everything the way it's meant to be done, but you'll add the next version, and that'll increase your stability and also strengthen all the stability that came before that level. Okay? So if you have any questions, shoot us an email. If you're a patient of ours, we'll see you in the office. You know, don't do anything silly. Use common sense. Pay attention to the details. And when you perform them, keep in mind that we're working to being able to stand, walk, and run. So your foot and everything should be in a good alignment for that. If your leg is way over here instead of under you, you're wrong. If your leg is rotated internally or externally and things aren't lined up, pay attention to your body, adjust that. And if those imbalances persist when we get to looking at a static posture, there are corrections where you can fix that problem. But we fix movement before we fix static posture, because the way you move is what's going to lead to your posture, right? Your posture is the result of the way you move. But then once your posture is really compromised, it affects the way you move. So you get stuck in a catch-22 there, okay? So put these videos to work for you, to work for your loved ones. A lot of people get a lot out of these. Boy, PT should be so simple, but with that, it's our gift to you. So make well, be blessed, and we'll see you on the flip side.